So let's talk for a second about implant removals or explants and whether or not insurance will cover your surgery or a portion of it. So I do a lot of explants, and I'm always asked in my consultations whether or not their insurance will cover any portion of the surgery. So here's how to navigate that and figure out if they might cover your surgery. So the first step is to call your insurer and find out if they have an exclusion for cosmetically placed implants. So if your breast implants were placed for a cosmetic reason, some insurers will not cover any complications or problems from your breast implants. And that's unfortunately the end of it. There's no way to appeal it. It doesn't matter how bad your problems are. They just don't cover it if you have an exclusion in your plan, which sucks. That's not often the case. Usually there's a couple scenarios in which they will cover a portion of your surgery. So the first scenario that they often cover is severe capsular contractures. So if you've developed tight, painful scar tissue around your breast implant, saline or silicone, insurers often will cover removal of the implant and removal of your capsule around your implant. The other scenario that's often covered by insurers is ruptured silicone implants, and you usually need to have some kind of radiographic diagnosis, meaning you have an ultrasound or an MRI that demonstrates this, and insurers will often cover removal of the implant and removal of the capsule around the implant for these patients. So let's talk for a second now about diagnoses and situations with breast implants that are not covered under health insurance. So if you have implants that were placed for a cosmetic reason that are saline and they break, that is not something that's covered by health insurance. I just said they cover silicone ruptures. That is correct. They do not cover saline ruptures, which is really frustrating to patients with saline implants that are broken. The next thing that they don't cover is breast implant illness patients. So breast implant illness patients that do not have a ruptured silicone implant or a contracture do not have portions of their surgery covered by health insurers. So breast implant illness right now is not a diagnosis that is recognized by insurance companies that has a covered procedure attached to it. So unfortunately, if you are suffering from your breast implants and you don't have those other diagnoses, your health insurance will not likely cover any portion of your surgery. And then finally, textured implants. There's a lot of women that have been interested in removing textured implants because of the risk of BIA-ALCL. And unfortunately, this just isn't something that is covered by insurance companies unless you have one of the other diagnoses that we talked about. So you always see a lot of information online where somebody swears they know somebody who had an implant removed from some of the diagnoses I said aren't covered. And I'll tell you, I've just never seen it, and I do a lot of this surgery. And whenever I've had a personal patient who's come to me for some kind of revision, who's told me that story, when I actually looked at their records, they had a contracture or a rupture or some other reason why their surgery was covered, or they were a prior cancer patient. So we try to get as much money back as possible for you guys, but there's the facts.